everybody, welcome back to my channel. It is actually the 5th Monday of January, and because I had not planned on actually recording a video for today, I have decided to add a little special video here, and today I'm going to tell you my vision loss story. So in one of the videos that I did in December 2021, I did talk about my journey to a guide dog, which touched on some vision loss issues throughout, my journey towards a guide dog. But we're going to go even more in depth than that. If you follow me on Facebook at Life as a Guide Dog Team, I did post an album with pictures of different times in my life and kind of just my story throughout the month of November, because November signifies the start of my vision loss journey. I will link that album down below since it is on my public page so people can actually see it. But I'm gonna actually talk about it. I don't know if I'll talk about every single thing that I mentioned in the album and had the pictures with, but I kind of wanted to do a story time and just talk about my vision loss and just the feelings that came around it. So my vision loss story starts Thanksgiving Day week of 1995. I was 15 years old. I was a sophomore in high school in a brand new school, and I got pink eye, or what at least they categorized as pink eye. I was given an antibiotic eye drop, and from there, I was told couldn't go to school for the week. I remember cleaning my eyes every single day as they were goopy and really red and swollen. So a typical pink eye presentation. We did that for the week and it seemed like they were getting better, but it now felt like I had shampoo in my eye all the time. They were super dry, super red, and nothing seemed to get rid of it. So I want to say it was the weekend after Thanksgiving because nothing was open. We ended up going to the Walmart Vision Center and ended up seeing a person there who looked into my eyes and kind of said I had inflammation going on at the front of my eyes and they were really scratchy and red. And basically, they could only prescribe me an anti-inflammatory eye drop and told me to use artificial tears and to continue using the antibiotic because they didn't want my eyes to get infected. And to then follow up with my primary care doctor. So we did that. And it did take some time. I remember getting in with my primary care doctor because we had just switched insurances. So, it just takes that time with new patients. And so we got in with my primary care doctor and they actually paired me with somebody who had kind of some specialty or something in the eyes along with family medicine. So I saw them. And he told me that I needed to be referred to a specialist who came down from OHSU, which is Oregon Health and Sciences University, and came down our direction once a week, once a month, it was something like that, to a local clinic. And I needed to see him, but he would put in the referral. So probably, I would say sometime in early 1996, we got in with this specialist and kind of was left I feel like with a lot more questions than answers, but that's like looking back on it now. I don't remember a lot of this time in my life. A lot of it came from my mom and her feelings as, her daughter was dealing with something that she had no clue what it was. We were given a name of uveitis and kind of told that I needed to go on a dilation eye drop. I needed to stay on the anti-inflammatory eye drops. But in addition to that, we were also told that I was allergic to the eye drops that they had given me for pink eye that I was currently still on. And so he told me I needed to go off of those eye drops and that I was allergic to them and I should never have those eye drops again. He also told me that I needed to have an injection of steroids right into my eye to clear up the inflammation that was on the inside of my eye. My mom felt very, she had so many questions. And in fact, this doctor, who I definitely will not name any of my doctors in this story, he did not leave a very good, taste in her mouth from a lot of different things that he did in regards to me and how we felt. I ended up going up to OHSU and having this injection done, which I'm definitely not going to talk about because I feel like I had a lot of PTSD because of this injection and how it was done in 1996 versus how they're done now, which is very different. I had the injection and was told I needed to be on these steroid eye drops every hour while I was awake as much as I could. It was currently affecting my left eye, and it was just in the surface of my right eye, so they weren't super concerned, except I was in just eye drops in the right eye for mild inflammation, but it was primarily in my left eye. By the time I was diagnosed with this, I had lost half of my vision, so half of it was actually black. And then the rest of it, it was corrected, I think about 20/60, 20/70. It was somewhere in that range. And I saw him a couple more times, just routine appointments. And he basically told me to come back when there were changes. I came back a couple different times and he kept saying everything looked great. And I saw changes, but he didn't see any changes. So I was just left with basically, living my life. We were given no outlook. We were given no answers, which in hindsight was the best thing I could have had happen to me as a teenager, because I was given no outlook and what this was going to look like in my future. I lived life. I lived life as a teenager, enjoyed school, enjoyed playing in the band, had high expectations of what I wanted to do as an adult and my career and going to college. Sky's the limit. And I used to have people say, aren't you scared? Aren't you afraid? And why? Why should I be afraid when it was just in the one eye? My career did not have to have two eyes, and I could still drive and I could still golf and enjoy what I was doing. So why was I scared? I never could grasp why they kept asking me if I was scared, because I wasn't scared. So I would graduate high school with honors and I would go to college and basically live my, teenage years from 15, 16 through the time of probably around 19, with not really a care in the world. I no longer saw my specialist, kind of just thought everything was done because that was the impression we were given. In 2000, I was living on my own, and I was living without insurance at the time, and I remember waking up and not being able to see out of one of my eyes. And I remember thinking, well, that's weird. Okay, when did that happen? But then as time progressed, it didn't get any better. So I ended up calling my mom because I had no clue what to do. What did we do, 15 or 5 years ago? What did we do? So I called her and I was like, Mom, what do I do? Like, I can't see out of my left eye at all. I don't know what's happening. What do I do? And so she ended up contacting her optometrist at the time and was able to find out if I could go see him and if he was willing to look at me, and like her and I would split the cost, because I was a college student, or right out of college, when I stopped college, I was working, living on my own. I didn't have the money to spend hundreds and hundreds of dollars to go to this optometrist. And he agreed to that. He agreed to see me at like a lower cost, and that my mom and I would split the payments on it. So I ended up going and seeing him, and he kind of told me not a lot, because he didn't know. He said there was something wrong and it was beyond his scope of work. And I, appreciated that. But he also gave us resources to go to an ophthalmologist in the Portland area that worked with people with no insurance and little to no income. It's called Devers Eye Clinic. It is also run by the Lions Club, so they have a lot of funding and are able to, pay for people's eye care when they can't afford it. And so he sent us up there, and I was seen up there by a doctor, and it was the first time I was put on oral steroids. They had given it another name, so now instead of uveitis, it was now being classified as toxoplasmosis. And they gave me oral steroids and eye drops, and that's what I was supposed to take. So I did that. It cleared up after a length of time, probably not very long, probably less than a month. And then I was weaned off of oral steroids and basically, again, told to come back when things changed. It was still only in my left eye at this point. So I went again along living life. I had my daughter, and shortly after having my daughter, it wasn't right again. So I went back to Devers Eye Clinic and saw somebody there. And again, I think they probably put me on oral steroids, possibly at that point. I don't remember 100%, but my guess is probably. And basically I went through the whole thing again of come back when you see changes. So it was probably not until late 2002 that I noticed my right eye was not exactly acting right. By this point, I had lost 95% of my vision in my left eye. It was almost completely black except this little sliver. So if there was stuff going on, I had no clue. But my right eye was now all of a sudden not acting right. I don't remember exactly what it was doing, but I know it wasn't acting right. So I ended up going to a different doctor in the clinic. They have a 2-story clinic, and it's the upper floor versus the lower floor, where like the more specialists are. And I saw this doctor, and he gave me a new diagnosis. He gave me a diagnosis of ARN, and was basically told that he was leery about putting me on oral steroids at the time, and he put me on eye drops, and I was then sent to the KCI Institute at OHSU again to be seen by a different fellow. And I saw this fellow, and by this point the drops had kind of gotten me back up to 20/20. So they just kind of kept this diagnosis of ARN, and I had no clue what that was. And they put me on an antiviral. And I was put on this antiviral and it didn't do anything. But my vision was still 20/20. But the fellow then sent me to a doctor in early 2003 after I had a retinal biopsy to see if they could find anything with the retinal biopsy in my left eye. Found nothing, ended up taking the last little bit of vision out of that eye, but I couldn't see hardly anything out of it anyway. And when all those test results came back, I ended up going and seeing a new doctor. It's actually my current uveitis specialist. He is a uveitis specialist specifically, so they sent me to him, and he looked at me and he said, "You have what? Like, this isn't right." He said, "This isn't ARN. I'm not really sure what it is at this point, but it's definitely not ARN." So he took me off the antivirals and watched me for a little bit, but he said I was fully inflamed, but my vision was still 20/20, so that confused him, but he just kind of went with the flow. He did eventually diagnose me with what I currently hold as my diagnosis, which is multifocal choroiditis, basically the inflammation of my retina and my optic nerve. And then in March of 2003, I ended up contracting bronchitis and was coughing like crazy, and ended up having a major hemorrhage in my eye, which cost a lot of vision, thankfully temporarily. And I went through that, which totally scared him like crazy, scared all of us, in fact. It was one of those times I had every single doctor in my room at one point, and everybody had a different opinion. So we got through about 3 months or so of the blood absorbing in my eye, but my vision wasn't quite coming back to normal. And so we chatted and decided to put me back on oral steroids. It was the only thing that would ever take away the inflammation. So we put me back on oral steroids, and almost like that, I was clear. And we have a joke about what he did, and I won't embarrass him, but so I was clear and he was elated. But as he tried to bring me off of oral steroids, I would flare. And this is probably one of the most active times in my vision, was this series of a couple years. Anytime he would bring me down off of my steroids, I would flare. And so he'd try to bring me down slower, I'd flare. So he ended up putting me on some immune suppressive therapy drugs. He had me on 2 of them, both cyclosporin first, and then added in the Cellcept with the prednisone, and could never get off of the prednisone. I was always on a low dose, and he was okay with that when I was both on cyclosporin and Cellcept. And then in 2004, I was losing my health insurance, and I didn't know what I was going to do. I didn't know how I was going to get my medications. I didn't know how I was going to be able to see my eye doctor. He tried and tried and tried with the insurance company that I could get, state health insurance, but they were not covering adults anymore. And I tried and I tried and I tried, and I couldn't get anything. So we decided to put me into a study for Remicade, which is an IV immune suppressive drug. And so we put me into the study, which allowed me to have visits with him for free. The IV Remicade was for free. I could get my prednisone through them for free because it was in the study. Like, it was one of the best things. Eventually, I did end up getting my insurance back. I got insurance through my employer, which helped a lot. So I had second coverage for my eye stuff. But, for a while, it was just the Remicade study. And I did the study for about 2 years and seemed to be tolerating it well until June of 2005. I was kind of dealing with some weird vision fluctuations, but thought it was allergies and the stress of getting married. And shortly after I ended up getting married, I noticed that my central vision distorted really bad. And I instantly called him up, and they got me up there that day. And sure enough, where all of my inflammation had been on the outside, it went straight to the middle, and I now had a lesion in the middle of my vision on my retina. They were able to get it to go away, but basically I failed Remicade because that happened. And so I was taken out of the study, and we had to think of something new to do. I was on oral steroids again, high doses, but it did leave a central scar that slowly did get worse later on. So it is now November-ish probably of 2005, and I needed to know what we were gonna do. We had two choices. I could either go on a chemotherapy treatment for a year that is chemo, all the same complications as chemo, or I could have a steroid implant implanted, which had its own complications. I was, 25 years old. I was newly married. My husband and I wanted to have more children. So chemo was not what we thought we were going to do. So I ended up having a Retisert implant implanted in late December 2005. The Retisert implant itself and the steroids and the inflammation never had any problems. I was inflammation free for many, many years. But the complications with a Retisert implant is there's a chance you can get glaucoma and your cataracts will come around. So guess what? I got glaucoma pretty badly. And in March of 2006, I had my very first glaucoma surgery, which did not go as well as it could have. And I had a doctor who did not really look into my medical history very well and did things like he was used to doing things, and that was not how they needed to be done with me. So my pressures dropped dangerously low. They in fact thought I was going to go completely blind due to lack of pressure, and it did come back. But in the fact that it came back, my whole eye swelled inside, and I had blood vessels breaking through, causing leakage, and basically from then on, I was classified as legally blind. I drove to my eye surgery and could never drive again. I was diagnosed as legally blind and could not get any better because of all the swelling and scar tissue that had happened in my eye. So we got through the complications with the glaucoma surgery. This included having to have injections to get the blood vessels to, retract and stop leaking. And we did that. And so we got through it. I ended up having to have my cataracts removed, which was probably one of the simplest surgeries I've ever had to have done. I had it done on both eyes because my left eye was getting a closed angle glaucoma, and then my right eye, it was just so thick that I couldn't see through it. And so then I ended up having glaucoma problems again. It probably would have been around March of 2008, I started having glaucoma problems again. And we were like, excuse me, why? And so I went back to my glaucoma specialist that I had, and pretty much he just wanted to fix my glaucoma that I had and the surgery I had had before that had so many complications. He just wanted to fix it and be done with it. And I wasn't ready to say that's what needed to happen. He didn't want to put me on medications. He didn't want to do anything. And so I remember going to my eye specialist, my retina specialist, and telling her that I would never see that man again. And so she ended up referring me to another glaucoma specialist who we learned so much from him. First thing he said was, "You are way too complicated for my practice." Well, thank you for being honest. He told us that I should have never had the glaucoma surgery I had, that it was, I should never have had it, and 99% of people who have my eye condition or an inflammatory condition will fail that eye surgery because of the inflammation and the scar tissue. So that left us going, well, what do we do? So my doctors, they treated me with their expertise as much as they could. And when it got to the point where they couldn't do that anymore, there was a new glaucoma specialist in the clinics, and they referred me to her. And she tried everything, all different kinds of combinations of eye drops and oral medications, and she tried everything. And the day she had to tell me that basically I had to have glaucoma surgery again, we both cried. And I remember feeling like she saw me as a human. So a couple days after her and I cried in the doctor's office, she would perform my second and last glaucoma surgery. She would put in a tube instead of like a hole. And I was told that this was the surgery I should have had before. So she did the right thing and had a list on a piece of paper of everything that happened to me in the first surgery and how if it happened again, she would fix it. So we had a plan, and she showed me her list before I went in for surgery. So although I was super nervous, I remember feeling relief for the first time when it had to do with glaucoma surgery. So we got through the glaucoma surgery with no complications whatsoever, and it felt amazing to finally feel like, I was seen as this person and not just my eyes. And a couple months after that, after I had healed all the way, I ended up having a second Retisert implant, and had some minor complications with that, but for the most part, everything went well, and I was ready to basically live life. We got rid of all of the complications between the first and the second Retisert, and it was like my time to live. So I spent that time with my daughter. I spent that time working a lot, but being present with my daughter as much as I could, finding things to do with her in our new area because we had moved. I found joy in things again. And I started to assess my life and what I wanted my life to look like, because I felt like finally I could live this life that we wanted to live. And although we had some starts and stops and stuff, for the most part, I really did assess how I wanted to live, and we made a plan. In the middle of this plan was the fact that my Retisert was expiring. They only last so long, and my retina specialist wasn't sure if she was going to be able to get any more Retiserts in time for my Retisert to expire. So we had to kind of make a split-second decision to have my third Retisert implanted in November of 2010. Well, this surgery did not go as well as we had hoped, and I ended up hemorrhaging during surgery, and basically for the first 4 weeks after surgery, I saw pretty much red. I didn't see a whole lot, and we just had to let the blood absorb because there was a lot of it. And I was no longer working, and I was just basically stuck in my house. At this point, even though I had been classified as legally blind, I didn't walk with a cane or anything, so getting around was, not happening unless I had somebody there. I ended up having some more complications after that first surgery. I ended up getting extremely nauseous with one of the medications they gave me. I ended up having what felt like nerve damage in my face, and I kind of just had a few setbacks throughout it. But December came around. It was about 5 or 6 weeks later, and she said she had to put the new Retisert in. She could not put the Retisert in after I hemorrhaged, and so she was going to put the new Retisert in, and it was right around New Year's. And right before that, she noticed that my lens did not quite look the way it should have looked. And so she ran some tests, took some pictures, thought she could just adjust it when she got in there, and that was going to be what was going to happen. Unfortunately, that's not what happened. I made it through the Retisert implant, surgery with flying colors, except she had to remove my lens because my lens actually crinkled because of the inflammation around my eyes. I remember when she told me this, I was super scared, and I cried. And I'm sure she cried as well. But she told me this was not the end of the world. They would just put me in Coke bottle glasses and I would be okay. I'd be able to see. It wasn't going to, change how I saw. They just had to correct it differently, which was super uplifting and exactly what I needed to hear at the time. So we just kept going. And beginning of February, I went in for surgery, or I went into the doctor's office and they removed some stitches in my eye. And, a couple days later, I noticed that my vision was slightly tinted. It's the best way to describe it, I think. It was slightly tinted. I thought maybe when they pulled the stitches out, I had bled a little bit. It was just slightly tinted, a reddish color, and it didn't seem to focus right. So I got into the doctor's office and they were like, oh boy, my retina had detached. Not all of it, about 60% of my retina had detached. Wasn't what they were expecting. What they said happened was that the scar from my old Retisert pulled it off. And we went in for reattachment surgery and I had air bubbles and I did everything I should have done. And then President's Day, which was, I think, February 21st, rolled around. And all of a sudden, I was seeing like black. My eye was not adjusting right, especially going from light to dark. I kept telling my husband something was wrong. I'd lay down and it would clear up. And then after a little bit, it would get dark again. I was calling the doctor's office and not getting the responses that I wanted. I was being told, well, that's pretty normal. You're on dilation drops. I was told, well, just rest your eyes. And I just kept saying, no, something is not right. Like, something is not right. And we decided we didn't care. We called up the on-call doctors and said that we were heading up there because we really didn't care. And so we headed up there. And all of a sudden we see my doctor. And this is my surgeon. I should clarify. I have a retina surgeon and I have an inflammatory disease specialist. So this is my retina surgeon. We see her and she sees us and she's like, well, what are you doing here? And we're like, were you not called? And she's like, no, I was not. Well, what's going on? And we said, there's something wrong. And she knew something was wrong because I could not see her. I could not see her shape. So I was not looking at her. And she saw this and was like, oh boy. She rushed me in as she's waving at the on-call doctor going, I got it, I got it. So we get in there. And she says, sure enough, I actually tore my retina and fluid was collecting inside of it, underneath. And she said, oh my gosh, we have to get you into surgery like now. Well, they ended up getting me into surgery the next day. So she fixed it. She, lasered it. She got rid of the fluid. We had air bubbles and got through all of this, and we made it 2 weeks. We made it 3 weeks. We made it to, I think, about 5 or 7 weeks. I can't remember exactly how far we made it. It was in April. And then I remember sitting in my house and I went, something's wrong. And my husband kept going, well, what do you mean something's wrong? I said, something's wrong. I couldn't pinpoint what it was. I just had this sense that something wasn't right, but I didn't know what it was. So we called up my surgeon because it just didn't go away. The feeling did not go away. And she told us that she'd meet us up there. And we ended up seeing her. which normally you see the on-call doctor. She's not usually on call, but she's like, I need to see her. If she's saying something's wrong, something's wrong. So we went up there, and after a number of tests and things, she looked at me and said, how did you know something was wrong? And I said, I don't know. I just did. Just knew something wasn't right. And she said, I don't know how you knew that, because you would not have known that. But my retina was detaching again. And so we went in again, and she decided she needed to put in a buckle. But that meant she had to pull out my glaucoma tube. And that was scary. But my glaucoma surgeon said, well, if we have to put it back in, then we have to put it back in. But I would rather my cornea not get damaged and have to put back in a glaucoma tube, because we don't want cornea problems. So we did that. I never had glaucoma problems again, still to this day. And we're on, over 10 years later, I've never had glaucoma problems again. And yeah, life was stressful. But we were getting through it, and we finally felt for a while that we knew I would be inflammation free, and hopefully I would not have a detachment. And I never did. Never had a detachment again. Went inflammation free for almost 4 years after my Retisert. Retiserts are supposed to last about 36 at most. We thought we had beat it. We thought my disease was in remission. We were all excited. Until one day I went up to the eye doctor's office. I had no, sixth sense that something was wrong. Went up there, and he looked at me and he went, you're inflamed again. I had a lesion again. And I was so defeated. I have theories on what caused this, but they're just theories for me, so I'm not going to go into my theories. And I said, really? And he said, yeah. And that was very upsetting, because we didn't know what we were going to do. So he put me on oral steroids again, and we tried to get me off of them. Tried to get me off of them with no luck. So again, we were in this spot like we were in 2005, where we didn't know what we were going to do. They could implant a Retisert, but it was risky, because the whites of my eyes were so thin. There was just this one little spot she could have implanted it. We knew that worked, but the risk of going under surgery and her not being able to sew up the whites of my eyes was super scary. Then we were thinking, and I brought up the fact of the medication he had brought up to me in 2005. And I said, what do you think? And he said, I haven't used that drug in years. He said, I don't know. But maybe this is the answer. So it did take a long time of talking and praying, my husband and I, and talking with family, that we decided that the surgery was too risky. Because the thing was, if I failed surgery, I'd be blind. But if I failed chemo, I still had the surgery option available, and we felt like that was better. We were past the point of where we wanted more children. I, was okay with the chemo side effects that were to come, and that was fine if I could save my vision. And so, in September of 2015, I went on chemo, not the chemo that they were originally going to put me on, but an oral chemo medication. And I'm not going to get into everything with my chemo journey. Maybe I'll get into that a little bit later. I do have a website. I will link it down below. And I made it through the chemo trial. And that was, I think, probably February of 2016 when I got off of chemo. And I've been flare-free and medicine-free since then. And it feels amazing. I fear sometimes, especially with getting my COVID vaccine and my COVID boosters and things like that. I fear, but so far we are good. And the thing is, my doctors have been amazing during this. And I even mentioned to my specialist before I got my COVID booster, or I got my COVID vaccines. And he says, we'll figure out what happens if you end up flaring, because we can treat a flare up, but we can't treat, death or some of the side effects from COVID. And I said, well, if I flare, I'm going on chemo again, because that was what worked. And it bought me so many years of medication free and being able to heal my body and being able to be medicine free. And I had already dealt with all of the side effects already from chemo, so it wasn't going to do any more than it had already done. And he looked at me and he said, I can't believe we did that, because that was the scariest time I had ever known. And I would never have known. And he says, we're going to be having more doctors on our side during that, because that was really scary. And said, I'll try to do a video on my chemo journey later on, but there is a website that talks all about my chemo journey. But so far, I haven't had to go on to chemo, and I've been flare-free, and it feels amazing. So my vision loss story is, of course, personal to me, and people with multifocal choroiditis all have different symptoms, and they all have different vision loss stories. But this is mine. So I hope you enjoyed this really long video talking about my vision loss, and I hope you get a better sense of what I dealt with for the last, 25 plus years of having multifocal choroiditis. And I've learned so much. My doctors have learned so much. And I figure all of my struggles has helped one person, because my doctor knows that the struggle I had, he knows how to fix it so that the next person won't have to struggle. And that's all I can ask for, is that my journey helps one of you. So thank you for watching, and I will catch you in the next video.